The way you clapped me in, I thought I'm going to do a TED Talk. But good to see you all, and it's always good to have the postprandial slot. So either it means two things. You're going to sleep and not listen to whatever I say, which is good, I can run through, or I have to keep you awake, which is, it's your choice. But good to see you all. I'm Raja, that's what people call me, and I'm a GP. I work at Hawthorne Medical Centre and John Street. I've got other hats as well, so I'm an Associate Medical Director at NHSGM, and also the Clinical Lead for Rest Medicine at GM. So air quality is what I'm going to talk about. So it's about how basics affect our health, because sometimes we don't really think about why basic stuff like air that we breathe could have such a big impact on all of us. So I don't know where the clicker is. Is it this one? So I've had some contributions from Neil Bendel. So Neil is our star in Manchester City Council. He's just the people who do intelligent stuff, and they call it health intelligence as well. So he's contributed a lot to the research and other things that I'm going to talk about today. Has he moved? Excellent. Okay, so I can see there, and I can see you, and hopefully you can see behind me as well. So air quality, why is that important? If you actually work on air quality, it reduces the carbon dioxide. So if you reduce carbon, then automatically that impacts on your carbon footprint. And of course, it has a good impact on climate change. Public Health England, when they say poor air quality is the largest environmental threat. So it's not like, another threat that we're dealing with, but it's the largest environmental threat they're dealing with. Why? It's got lots of problems because of air quality. So you've got the personal cost, you've got hospital admissions that go up, you've got school attendances which are less because of poor air, you've got business productivity that goes down. So air quality isn't a simple thing to sort out, but it's a significant thing that we need to be sorting out together. Hopefully it's moved to the next slide. So why is that important? I was struck by, so many things that we do unconsciously. I think most of you think you drive unconsciously. How many of you have driven, actually? So I wasn't going to tell you off, but we do that, subconsciously do that. And then, of course, we breathe subconsciously, unless anybody learning to swim? I'm trying to, and then I know how it is to be under the water and try to breathe. But when we're normal like this, you don't even think about breathing, and you breathe 11,000 liters of air, and you do about 20,000 breaths a day. Isn't that fascinating? And you don't even think about it. Obviously, you're breathing when you're sleeping, you're breathing when you're talking, you're breathing when you're swimming, and you're breathing all the time. But you take that air in, isn't it? So what is in the air? How's it been today? What's been in the air today? Lots of wonderful talks? Yeah? Lots of wonderful talk. But what's in the air that I'm going to talk about, which is a pollutant? So any chemical, which is there in the air. What's been in the air over the last 3 years or longer? COVID-19. Who was that? So we've been breathing in COVID-19, but then there are other chemicals as well which share the space with COVID-19. So any droplets or particles in air which has an impact which is damaging to our health, then of course they're called pollutants. Then you got fancy names, which is like particulate matter, and depending on the size, you've got 10 and 2.5. So basically 2.5 is much more smaller. 10 is of course the size which is bigger. So they're quite dangerous because they're small, so you breathe in, and actually they manage to get it into the depths of our lungs quite easily. Compared to our little toddlers who might put something in which doesn't go beyond, some of the airways. But these ones can actually get as deep as possibly they can. And that's what is linked with very poor health outcomes for us. So they are the N numbers. So the NO2, the NO, NOx, the E numbers. Are you aware of E numbers in your food, your processed food? Yeah, similarly, N numbers are not good in the air. So remember that. So nitric oxides and nitric dioxide, not good for us, and they are the ones, which also result in smog when it's really, really bad. Okay, and then the next one is the indoor air pollution. Did you get a break to go out as well today? Or you've been sat here? Sat here? So not a doctor today. But 90% of the time we spend indoors. So of course, the quality of the air that we breathe in when we're indoors also matters. So we have to be careful about what we breathe in, which is why we would hopefully all have carbon monoxide alarms, because carbon monoxide is a significant thing which is in there. You've got lots of different aldehydes and organic solvents and other things which are there. And the other thing which I spoke about many years ago in deprivation training, wasn't it? I can't remember when it was that, but it seems a long time ago, when we talked about cigarette smoking. We talk about the impact on us, but it's actually the smoke that it leaves behind, which we call it environmental tobacco smoke. So if we have in a house and somebody's smoking, the air in the house actually gets filled with the environmental tobacco smoke, which is also quite dangerous, especially to children and the adults and pregnant women who get exposed to that. So those are the two things. So one, outdoor air pollution, and then indoor air pollution. So both of those air that we breathe in is obviously significant. Can you see that? Okay. So different compounds. So I'll pull this all together. So you've got the NOx, which is the N numbers that I talked about, which usually comes when you actually combust fossil fuels. Anyone has diesel cars still? You don't have to put your hand up. You don't have to put your hand up. But diesel cars are really bad for those N numbers. You've got obviously the commercial waste, and of course they peak in winter, like anything else. There's something about winter. I just talk about winter planning again in the commissioning world, and somebody said, can we just cancel winter? That'd be great, isn't it? We could just cancel winter. And then the 2.5 PM, which also has a significant impact on our health, which again, can you see wood burners in there? Who has got fancy houses and beautiful wood burners? Yeah, you don't have to put your hand up, but it's all right. So those are the things to reflect on, or the brake dust, and they peak in spring, along with the pollens and whatever, but they actually peak in the spring. And then you have the environmental tobacco smoke, which are the three significant things that actually has an impact on our health, which is nitric, the NOx, the PM2.5, and of course, the environmental tobacco stuff. So what are the effects on health? So I was looking into this because we always talk about the long-term effects. But I remember, because I grew up in Delhi, and when they talked about dirty air in the UK, I was like, what are you on about? It's like, what are you on about? Because I remember as a school journey, I'll always be crying. And I'm like, it's not because, I was getting emotional or falling in love or whatever. It was because it was just dirty air. It was just irritating my ears and nose and all the other stuff, till they did something, which is they changed everything to gas, and then suddenly the air was a lot more cleaner. But when we talk about dirty air here, I was like, oh my goodness, this is clean air, clean water. But of course, there's still dirty air. And the short-term effects, you'd cough, you would wheeze, you'd become dizzy, you'd be nauseous. So you really don't want to be breathing in. If you've not done that here, then of course the quality here is good. So that's a relief. But you get hospital admissions are directly related to poor air quality. So anybody with COPD, if they get exposed to really bad pollutants in the air, that can really trigger the lung condition. And of course, when nowadays we're better with barbecues, aren't we? But when they started fires in the forest and stuff, and the smoke comes and travels, that sets off people's lung conditions, and then obviously hospital admissions come up. You get illnesses, you get things like pneumonia, bronchitis, heart attacks can be caused by air pollution. You don't think about it, but all of these things can happen. If I move to the next slide. So it doesn't just limit that, if you think about the short term, these are long term as well. So they affect, they've done a lot of study and they try to link dementia with air pollution, but we still don't have enough evidence for that. But there's enough evidence to say that cognitive decline or cognitive problems happen because of air pollution. They damage our immune system, they damage our nerves, there are lots of stuff. I told about heart attacks, and cardiovascular disease is another problem that happens. And of course, respiratory. It causes cancer. I think that wouldn't come as a surprise to the audience here, but it's classed as a class 1 carcinogen, which means it's better that we breathe clean air if you want to prevent ourselves from getting lung cancer. Yeah? Any questions so far? Okay. So long-term effects, it accumulates throughout a person's lifetime. And again, a personal story of mine, which is, my mum in India used to be, when we were growing up, we used to use wood to actually cook food, because you would burn the wood, and that will create the fumes and, of course, the fire, and that will cook the food. And, of course, she grew up in Delhi, so was exposed to air pollution and everything. And then we realized that actually, you don't think about those that will result in COPD or anything like that. And then I now find out that actually she has got chronic lung damage because of this. And more than likely, it's the air pollution and the wood stuffs that she used when we were growing up as children. It's a lot better now, but you can think about, and all of these things over a period of time, it accumulates, it grows up, and then that has a significant impact on our health. And of course, after all of that, you do have deaths because of air pollution. And that's what we call as an attributable risk factor. And you clearly say that air pollution is a significant reason for the person's death. And children are very vulnerable to ETS, so we need to be thinking about smoking and smoking within our houses or within homes that we see in our patients. Children are very vulnerable to the environmental tobacco smoke. And it's glue air, and when they grow up and when they get problems with the lungs early on, there's a lot of evidence to suggest that they actually end up having long-term lung damage if the childhood wasn't great with regards to the air that they breathed and etc. So next one. So if I take through the life course, so if you think about the pregnant women and in the womb, it affects the child in the womb. So the lower birth weight, you also have stillbirths, smaller heads. So there's such significant things sometimes we don't think about, but all of this is there for the evidence. And then when they're toddlers, they of course are running around. I don't know how much air they breathe, but I'm sure they're probably taking more than 11,000 breaths or 20,000 breaths. They're obviously running around, wheezing, coughs, chest infection. And if they grow up a little bit more, they've got a lower lung function, you've got asthma, and then of course, when you become an adult, then it doesn't stop. You've got the lung function, declines. Type 2 diabetes is another thing which can be caused by air pollution, because again, I was like, thinking about all of these things, heart attacks, and then you start with lung cancer. When you get old, again, the same things, but, the lung function keeps on declining. So air pollution actually affects us right from the start till we reach the end. And that's what we always say as GPs, isn't it? We look after you from start to or cradle to grave. And air pollution, unfortunately, affects cradle to grave. And there's another slide about environment tobacco smoke, because I wouldn't dwell on this, but then our prevalence is a lot better now, but it's still quite high compared to the rest of England. We still have the highest smoking-related deaths if we talk about Manchester, and again, the same with regards to smoking-related admissions, and of course, childhood admissions of asthma is also significant. In fact, during COVID, something happened magical. Our admissions with asthma came down. And do we know why that could have gone down? Masks? Air pollution? I thought you would say because I was the clinical lead for respiratory medicine and I sorted it out. but it wasn't. It's just that the cars wasn't there, because I remember driving through those times, isn't it? Because you would just drive wherever you like, and no car would come, and you would get there much before time to your surgeries. But of course, the asthma admissions came down because I think most likely because of the air pollution going down. We can't really strongly correlate to that, but studies are there to suggest that when we do count how much nitric oxides and nitric dioxides are there in the streets and are on some places, which I've got another map that I'll show, but it was quite low during that time. And of course, we have under 75 mortality for respiratory and CVD in London. Okay, so the next one. So these are the premature mortality. We've got 5 minutes? Okay. So I'll run through this. So I wouldn't go, but it's just the number of deaths that could be attributed through the things that I talked about. So it could cost the economy up to 20 billion. At the moment, I think they're estimating 12 to 12.3 or something, but it could go up to 20 billion. Right, so another picture. So this is 5.9% of the deaths seem to be we could attribute to PM 2.5. We're pretty much similar to other boroughs like Blackpool and Sefton and other things. And if you look about the NOx monitoring, this was on the 19th of June. So because, like I said, we monitor nitric oxide, 3 permanent sites, and you've got Piccadilly, and it exceeded the levels that's been recommended. And then it was in Oxford Road, we again exceeded, but in Airport, it's within. And even the within isn't really the right amounts. We're still campaigning for the targets to be lowered. But even when the targets are not low, it's still exceeding in the places that we do monitor. So it's still a real problem. And when we talk about schools, there are 20 schools in nursery that we know, and it's the NOx is more than 40. So that's, when we said exceeded, it was actually more than 40. And it's quite bad in schools. And in fact, we have air quality management areas. Half of all primary schools within, in GM are within 400 meters of that, in the sense that air pollution is really high near those schools as well. These are the admissions. I don't know whether you can see clear enough, but you can see Manchester there, and then, of course, Liverpool, Blackpool, wherever you see all the red, the admissions for asthma, the admissions for COPD are all quite high. So I wouldn't dwell too much on this, but it's just to say that these are the things that we're doing to actually impact on air pollution, which is you reduce the traffic, and those are the things that you do. You increase the efficiency, so again, those are the things that you do. And of course, you also kind of try and improve the vehicles where there is a lot of work that's happening around that. And again, for environmental tobacco smoke, these are the work that's being done to kind of help with smoking. And again, help is available for all of that. But because today is like deprivation talk, so I can't not relate what I was talking about with deprivation. I'll let you read this, actually, because it's quite stark, isn't it, as is with anything that we do with deprivation. The social inequalities are actually clearer and stronger. The people who actually live in poverty have the highest levels of exposure, because the green areas are less, you're actually much more closer to the roads, the busy highways or whatever. The people who are poorer live usually closer to those houses. And of course, they are the ones get exposed more. In fact, the relationship is again inverse, because if you're actually much more richer, you generate a lot more emissions while compared to when you are poor. These people also own the lowest number of cars as well, and yet they get exposed more. They get more adverse effects. There's clear evidence that poor air quality actually contributes to health inequality. So when you think about premature mortality in our deprived population, air pollution is a significant attributable risk factor for that. And of course, environmental tobacco smoke as well, because the prevalence is quite high. So poorest and the most vulnerable in the community are unfortunately suffering the most. There are lots of campaigning that's happening. So Mums for Lungs, does anybody know about Mums for Lungs? It's really good. So please do look at the website. It's really, really good. And they've got lots of posters, and it's about, it's simple things like please don't drive to drop your child at school, just walk or make them cycle. But they've got, they've got a voice behind that. There are lots of work, doing work across the country, which is really good. And Clean Air Campaign is around, again, quite helpful. Asthma Lung UK, which is like the biggest charity for respiratory illnesses, they talk about Clean Air Campaign quite a lot. So if you don't do anything, take a picture of that, go into those or those posters. You can print it out, you can put it in your surgeries or wherever you work. Just to remind yourselves of what could be done. And of course, the councils and local authority do get behind. So I've finished now. Do I have a minute? Okay. So in summary, we are breathing dirty air. It's not Delhi, but it's still Manchester. So it's dirty air. It's poor health from cradle to grave. You've seen all those pictures. It's really poor health. It shortens our life. It widens the health inequalities that we already see. So anything to tackle air pollution would help to address that. Our vulnerable people are affected the most, and of course we're all in a climate emergency, and air pollution to be addressed is important if we have to have an impact on our climate change agenda. So what can we do? I put drive less, because lots of hands with driving. When you're in your cars, I hope you've got fancy cars which switch off when you're not driving, and especially, driving to match days or driving to school, try not to, but don't idle, because you end up, there's 3 times more pollutants in the car itself. So, if you stop idling, that'll really be helpful for you and, of course, the environment. You have the correct tire pressure. Wood burners, if you can reduce the use of it, or stop using it, then that'd be good. Walk more, cycle more, it's good for your health. And remember indoor air pollution, because the air that you breathe 90% of the time is also important. So think about how you can have clean air references. I don't know, I was looking for something to leave with, but I couldn't find anything. So this was what I quoted back in, I can't remember when, so just put it down so you could read and clap your hands for me.